It sucks. Anyway, so yeah, I talked to Kun yesterday. I thought he said he was going to show up today for class because he has a hotspot, Wi-Fi hotspot. So, but I don't know. I don't know what's going on. I don't know about the villages in Cambodia. I don't know about the Wi-Fi there. So,
I don't think it's worked well.
not good. Not good.
Yeah, I suppose.
Yeah, yeah. I don't know. Uh, hey, so anyway, before we start, why don't people show up to this class? Like my other class, I had all my students show up, and we were supposed to have like 8 people in this class, and now it's like down to like 4 people regularly showing up. Why is that?
I have no idea.
Huh? Because
And
my
but did they inform you what is their business?
uh not really. Like Rotanak said, like she's just going to work or something like that. And I'm like, wow, you're gonna be working this late? Like I thought that was weird. But also like we had a couple other people that just showed up for like a day.
Mhm.
Like that guy Kim just showed up for a day and then he said he was in an accident or something and then I don't know. It was weird. I don't know. My director did say that a lot of people don't show up for this class, don't show up for class. So I don't know. I'm just surprised, I guess, because my last class showed up. So I don't know. Just asking. All right. Anyway, okay. So gave you homework about cryptocurrency. I know it was a pretty complicated subject, right?
Yeah.
Yeah. By the way, I just heard a report
Um,
that now China, um, they are going to do digital currency, like
themselves?
no more paper money. Yeah, Beijing is going to give out like $2 million worth of digital currency, cryptocurrency, to its to its people in Beijing for a lottery to test out and see how it works. So literally, I just saw that on the news, and I was like, "Oh man, wow, that's pretty crazy." So, um, yeah, but anyway, so V, you want to read your homework?
Yeah, sure.
Okay, thank you.
Um, in my opinion, cryptocurrency has both positive and negative sides. On one hand, it helps people to make online transactions quickly, anytime, anywhere, 24/7. However, it's very private. It's you who manage the money, and the government has no clue to track your money. On the downside, some cryptocurrencies are initially dangerous. It makes people get involved in gambling mentally. Some people become addicted to the crypto investments. They put everything they have for the game. Additionally, some transactions are illegal made. Its decentralization helps criminals to exchange privately and successfully. It's actually the first time for me to know about cryptocurrency. I might hear some of it, but never understand how capable it operates in reality. Lastly, I think this digital currency will develop unbelievably in the future, and hopefully people will weigh its purposes carefully to avoid any loss from it.
Yeah, if you very good. If you when you move to the United Kingdom, I think that you will if you watch news like
Yes.
BBC, I think you'll hear a lot
Mhm.
more about cryptocurrency if you're listening to the news. So,
Yeah, I just saw some article like some people they lost £1 million from
hmm
Bitcoin.
yeah, yeah.
Yes.
But during the pandemic,
Mhm.
Bitcoin took off. So, like,
Yes.
there are people that you know, see, my whole thing is like you can invest in it, but don't invest all your money into it. Take one take 1% of what you have and invest in it, and then so that way you're in there. But if you lose it, it's not going to be the end of the world.
Yes.
That's my how I feel about it. So yeah. So let me see. Uh-oh. You didn't do yours. Oh, you're on mute.
Sorry, teacher, I
It's
didn't make
okay.
it. Uh,
It's okay.
it was rough today. Yeah.
A lot of work.
Yeah, I went to the field distributing the food to our target communities all
Okay.
day.
Yeah. So why don't you just tell me what you think instead? Okay.
It seems like I have I have no idea about this. Yeah.
Yeah. You have
So
no idea about cryptocurrency?
yeah, yesterday as I told you in the class,
Hmm.
I feel I didn't touch more about this. I feel like a little bit familiarity with this. Yeah.
How so?
Sorry.
Like, why is that?
Maybe it's something I have never heard before, or something that was not interest like that.
Hmm? Well, hey, listen. I put this link up here. If you want to read about it later, and also if you just want to Google cryptocurrency later, you can do that as well. So, all right, and then if you want to write about it later, you're more than welcome to. Okay.
Okay.
All right. So, Tier,
My turn?
yeah, it looks like you're in outer space.
Yeah. Okay, let me read mine.
Sure.
In my private idea on cryptical, I'm sorry, cryptocurrency, I thought it had pros and cons due to the manner of the single access. For pro, it's more comfortable for taking the cash online without scaring attacked by physical theft. Frankly, even proves it was good for access, but it still lacked several points, such as hacker can access to the bank account, laundry the money, etc. For cryptocurrencies lessons, I used to know them, but not quite clear. Last, I think the cryptocurrencies will still remains in use for the futures because nowadays the people around the world are sticking with the technologies to make their life easier things.
Good. Good job.
Yeah.
So here's a question. So you had work today, right?
Me,
Yeah.
I just arrived a moment to
Yeah.
my yeah.
So did you ask anybody about cryptocurrency in your at your job?
Yesterday my coworker asked me how to use the stock, and then
Ah,
and then at the evening I have a chance to learn with you for advance, and
ah,
that's why I told my coworker that you need to be careful about your buying the stock by online.
yeah, yeah. Stocks and cryptocurrency are the same to me as gambling if you are just doing it by yourself. Same, because you are spending money on something that we have no idea about. So, and I don't know about you, but my money is very valuable to me. So, I don't really gamble. So, if you want to know about stocks, I would say talk to an accountant or someone in a bank that has a portfolio, it's called. You know what? If you guys want to know more about stocks, I can do a unit on stocks as well. Would you like that?
Yes.
Like investments and who to talk to and
Mm-hmm.
stuff like that?
Mhm.
Yeah, I can.
Yes, it would be
Yeah,
great.
yeah, I could do
Like
that.
we can learn more how to invest our money carefully.
Oh,
Yeah, I think that's a good idea. All right, cool.
Yes.
Yeah, and I'll show you safe ways and unsafe ways. Okay, cool. So
yeah.
now I have tomorrow's lesson plan ready. So, all right, cool. Awesome. Great. So, unfortunately, let me see. Unfortunately, one of our doctors is not here today. I was hoping he would be here. You know
Who's
what?
that?
Kun,
Oh,
Oh, I see.
I'm gonna send him a message.
Mhm. And teacher, and
Yeah,
about many classmates, where are they?
exactly. I was just asking that. So, a couple things. So, um, one, that guy Kim said he hurt himself, and he said he was coming back to class, but he said he hurt his eye or something, and I'm like, well, you can still listen, but I don't know. I don't know what happened. I can't chase down every student that we have. Um, but
mhm.
Rotana texted me something about work. I don't know. It was kind of cryptic, and I kind of didn't understand, and I thought it was strange. But okay, that's fine. Um, the
You should have the specific reason for you or the
Yeah,
school thing.
I'm sure everybody has their reason, which is fine. I understand this. This is not required, and I totally understand it. Either you're invested to learn or you're not, and that's fine either way. And I also know that, this is also a complex time. So, um, I prefer that people show up because, I work hard to make these lessons every day. So, I want people to show up, and I think it's respectful. But if they don't, they don't. What can I say? I will say Kuhn did talk to me beforehand and told me that where he was going to be, and he said he was going to try. So that I totally understand. But the people that just don't show up, I don't understand. I don't understand that. Um,
Mm.
I was just saying to V actually that my last class, everyone would always show up. My last class. So, but I don't know. I don't know.
It's well understood, I think.
What's up?
It's well understood from your speech.
Yeah, I don't know. It makes me sad though that people don't show up. I will say that. I don't know. All right,
Okay. Yes.
this is gonna be a wild one. so
Wow, COVID-19.
So this is going to be a little easier, I think. A little bit easier. So we're talking about healthcare in America. Um, do any of you have an idea what healthcare is like in America?
Mm,
I,
must be.
I I don't know actually, but
This is going to blow your mind.
yeah, but I think it's good because the US is one of the powerful country. I think it's well
Mm,
already
you would
for
think that.
situation. But in terms of COVID-19,
Yeah.
at
That
the
was
beginning, sorry.
I think COVID-19 was more of a government issue, if you catch my drift, if you understand what I'm saying.
Yeah, of
Bad,
course.
bad,
Yeah,
bad leadership.
Mhm, yeah.
So Yeah.
for the state.
Yeah, I believe it too.
Yeah.
About-
And V, what did you say about healthcare? I heard you say something at the beginning.
Just
I think
don't
must
play.
be modern
That's it.
equipment. You know, like when
Yeah.
I watch Hollywood movie, always fancy hospital. So
Yeah.
I assume that it must be expensive
Yeah.
because like I never see the hospital in the movie like with low quality equipment, always brand new. So I assume that it must be expensive.
I will say that the average hospital in America is 30 years old right now. And Tier, check this out. Ready? This one's gonna blow your mind. The average veterans hospital for military is over 60 to 70 years old.
Mhm.
So if you are in the military, your hospital is 60 to 70 years old. So
The quality is still better, right?
hey, listen, I didn't say that. So I want to give you an example. This is Detroit, Michigan, which is a city in America. This is Windsor, Ontario, which is in Canada, to the north of America. So the uninsured healthcare, so you have health insurance, correct? Do you know what health insurance is?
Yeah.
Yeah. So health insurance is something that you pay every month. So when you go to the hospital, you don't get hit with a bill. Like car insurance. You know car insurance? Like for your bike or house insurance?
Yeah.
Yeah. Well, it's the same thing with your health. So V, you look confused. Talk to me.
Um, it's too expensive. So it means people have to pay for their health insurance monthly,
Yep. Mm-hmm.
even they don't go to hospital to
Yep.
treat anything.
Yes. Yeah. Yeah. And
Yeah.
you're gonna know why by the end of this, why you have to have health insurance in America. So the uninsured rate of people in Detroit, Michigan, which is, by the way, is a poor city in America.
Teacher,
Very.
can't hear you.
Hello. Hello.
I think maybe
You're
her
frozen.
internet. I think
Can,
maybe her internet.
oh, okay. Can you hear me now?
Of course.
Okay.
Yeah, I can hear you.
Yeah, I do now.
Okay. Cool. So the uninsured rate in people in a poor city of Detroit, their uninsured rate is 13.8%. And do you know what insulin is? Insulin
No. What
medicine?
what is that? What is that, teacher?
It's like insulin is like for something that maybe you use for diabetes. It's like a syringe to inject somebody. Like if somebody goes into a seizure, maybe they get insulin. It's like it's a medicine basically for people that have diabetes. So one
Uh,
one vial of this medicine costs $320 in America. So in Canada, uninsured rate is zero because Canada has universal health care, meaning the government has health care for everyone. Everyone is insured if they're a citizen of Canada, okay? Because the government takes care of all that.
Yeah.
And one vial of the same medicine in Canada is $30.
Wow.
So you see the price difference? Same
Yes.
thing, same,
It 10
but
times.
different. Yeah, it's really expensive. So I'm going to show you this video real quick, okay?
Yep.
You see what they're saying? If you took the healthcare system in America and made it its own economy, it would be the fifth largest economy in the world. Just the healthcare sector in America. I just want that to sink in as well. So we pay more for the same exact drugs as all these countries. And these are all developed countries, by the way. Correct?
Yeah.
So we have the highest rate of toward healthcare in the world, and here in America. Whoa. Ah. Okay. So, you were saying that you think that healthcare is good in America, right?
Yeah.
Yes.
Out of every out of each developed country, and I'm pretty sure I put this in my slides, out of each developed country, America ranks last in every single category when it comes to healthcare. Dead last, and it's not even close. Like we are dead last. So I'm going to give you some facts about healthcare in America. Who would like to read number one? Let me move this.
One, there is no universal health care. The US government does not provide health benefits to citizens or visitors. Anytime you get medical care, someone has to pay for it.
Mm-hmm. Yeah. And it's expensive. So, V, you are definitely right. It is expensive. Who would like to read number two?
Two, healthcare is very expensive. According to a US government website, if you break your leg, you could end up with a bill for
7,500.
seven. I'm sorry, a bit
It's okay.
sore throat.
Sorry.
$7,500. If you need to stay in the hospital for 3 days, it would probably cost about $30,000.
Yeah, and that's on the low end. I had I got back from I was in India, Sri Lanka, and Nepal in 2017, and about a couple weeks later, I ended up getting pneumonia, which is kind of like COVID-19. So I wound up in the hospital, and they put me on a machine, like a breathing machine, and it cost $63,000. 63,000 American dollars. Yeah. So, yeah, yeah. And I was in an old hospital, by the way. I was in a very old hospital. I think this hospital was 50 years old.
Teacher,
yeah.
pardon me. For example, I'm sorry if I ask you that is not deserved question. And for like the American people who work at abroad, do they need to pay the insurance for the local American healthcare, the same as the local person?
If overseas, if I'm in Thailand, do I have to pay? Is
Yeah.
that what you mean? Let me see.
Yes.
I did. So last time I was in Thailand, I'm trying to remember what I did because I did go to the hospital because I had to get some medicine. I did not pay for the doctor's appointment or visit in the hospital, but I did have to pay full price for the medicine because I did not have the insurance at the time. So, um,
No, no, no. I mean, you are in. You have
you're breaking up.
for the United States.
You're breaking up on me. Hello?
Hello.
Yeah. You're frozen, and your microphone is in and out.
Hello.
Yeah. Yeah.
I think maybe my internet is so bad.
It's okay. It's okay.
I want to ask you, like, the insurance in the United States is like a duty, right?
Insolent? Insulin?
Insurance
Insurance.
healthcare.
Insurance. Yeah.
Yeah,
Yeah.
yeah.
It's meant. It's yeah. You should have it in America. Yeah.
It is a duty, or
What do you mean
you
by?
need
What do you mean by?
duty, the government duty that you need to pay for
We're gonna. We're,
like a government check.
we're gonna. Government does not supply health insurance in America.
Oh, okay.
Not so ever. But we're gonna get into that. We're gonna talk about that. So
Okay.
this is gonna be a bigger lesson today. Okay?
Okay, thank you. Yes.
No problem, man. Okay. V, what do you think? You want to read that?
Yes, of course. With little regulation on drug prices, the US spends an average of $1,443 per person, compared to $749 on average spent by the other prosperous countries study.
Yeah, which means UK, Australia, New Zealand. Um, what's the other one? I think Germany was in
Canada,
there. Canada, yes. Um, so
Japan.
Japan, yeah, Japan. Yeah, so we so when it comes to regulations with companies, uh, America decided not to regulate. There is a political party that does not regulate. So when they come into power, they loosen all regulations, which allows prices to go up, and especially in healthcare. So, we get American people will get screwed pretty much. So, last or next to last, who would like to read?
Come to me again.
Sure.
The average US family doctor earns 218,173 a year, and specialists make $316,000, way above the average in other industrialized countries. American nurses make considerably more than elsewhere too. The average salary for a US nurse is about $24,250 compared to $58,041 in Switzerland and $60,353 in the Netherlands.
I was dating a nurse last summer, and she was making $100,000 a year.
Wow.
Yeah, I was shocked when she told me that. I was like, "Are you insane?" But she was getting her master's or doctorate, I think. I don't know. She's getting another degree. But yeah, and she's like really smart. But $100,000 a year for a nurse. So, and the last one.
I'll do it.
Yeah.
Despite having the most expensive healthcare system, the United States ranks last overall compared with 6 other industrialized countries: Australia, Canada, Germany, the Netherlands, New Zealand, and the United Kingdom.
Yeah. So, there's this, America has this reputation of, you know, I guess being the best at everything. And personally, I don't understand it, because in a lot of areas, we're not the best. We don't have, we rank last in a lot, and healthcare is a big one. Healthcare is a very big one. So, all right. So before we get into the next one, we're gonna stop and come back. Okay.
Okay.
All right, guys. See you in a second. Is there anything you want me to go over yet?
I think it's okay, but I have one question.
Yeah.
Should I ask or not?
Yeah.
Recently we discussed about academic tenure, talking about the high study fee, and now we talk about the healthcare in America, which is also expensive. Do you
Yeah.
think, is there any relation to the US GDP per capita? Because I just quickly Googled and found that the GDP per capita in 2019, it's about 65,300 something.
Yeah.
So is it correlated or just
There
expensive?
is. It's there is some correlation, but sorry. But the one thing that you have to know about America is that there is an increasing gap in wealth. So you have all rich people, then you have the middle class, and then you have poor. So what is going on in America right now, which I think is actually the opposite of what's going on in Cambodia right now? So the rich are getting richer, the middle class are getting poorer. So there's this wealth gap. So yeah, our GDP is high, but it's because we have a lot of rich people. We have a bunch of rich people, but we still have a ton of people in America that don't make money because we have to pay so much money. Is what I'm trying to say, is where I'm getting at here. So, um, I would just take the GDP aside at this point, and you can
Yeah.
look at that later. But
Yeah.
yeah, basically, I'm just trying to drive home one basic point about our system and healthcare. So, all right. So, does anybody know what universal healthcare is? Okay. How about
No,
this? How about this? Yeah, what were you gonna say, Tier?
no, that nothing.
Okay.
Yeah.
So, do you feel that healthcare is a basic human right?
Yes, absolutely.
Yeah, like water and air and all of that.
Yeah, because we can avoid getting sick. So we need to go to the hospital, and if we can't access to the hospital, it means we're gonna die.
Yeah, there are people in America that think that healthcare shouldn't be a basic human right.
What?
I
Yeah,
think for okay, like continue yours.
what's up?
Let continue yours, and
Oh
then
yeah.
I will add some comment about the
No,
universal healthcare.
no, I want to hear what you have to say.
Okay.
Yeah.
You know, in my country, like a remote area, many people are don't care about the healthcare system because how poor they are,
Mm-hmm.
and they cannot understand what is important about the healthcare. That's why I think that the United States is very best than Cambodia about the healthcare system.
Yeah, I have a student that is an amazing human being. She works for your government, and she is trying to implement a system of online government where you can pay online for things for government. If you have a bill or a ticket or a fine, you can just pay it online instead of going to government buildings. So she's trying to
Mm-hmm.
implement that system in your country.
Mm-hmm.
She was
Good.
in a yeah. She's and by the way, what an amazing human being. What a greatest. But you know what? I find that almost everybody in Cambodia is an amazing, nice, caring human being. So it's such a great country. That's why I like it so much. But she was in a bike accident last week and broke her arm.
Oh, you mentioned
Yeah.
about her before.
Yes. Yeah. 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 And she said that her even though she works for the government, she still has to pay $500 for her surgery. 500
Mm.
US dollars. That's a lot of money.
Mm-hmm. Yeah, sure.
Yeah,
Mm.
we do need to pay for the healthcare as well in Cambodia. So
Yeah.
it's quite sad if a member of our family got an accident or they sick. So we're gonna spend a lot of money on them.
Yeah, it's unbelievable.
Yeah.
And
She had surgery 2 days ago, and her she can't move her finger,
Mhm.
mm,
and when so me and the other student tried to get a hold of her to say, hey, how are you? You know, see how she's doing, and she's so upset because she can't move her finger, and she just didn't want to talk. But I said it's very early, and but yeah, you know, does America have better healthcare than Cambodia? Yeah, but we're paying just the same. We are paying just the same. Um, so yeah. So anyway, so universal healthcare. Let's get back to it. Sorry,
Okay.
we're gonna run
Mm-hmm.
out of time here. So universal healthcare is somebody want to read that?
Yes, sure. Universal health care is a system that provides quality medical service to all citizens. The federal government offers it to everyone regardless of their ability to pay.
Yeah. So Canada has universal healthcare. So the government pays for everything.
Yep.
And in I don't know about UK. I don't know about United Kingdom what they have.
They do it as well.
They do it.
It's called it's called NHS National Health Service. Sorry.
It's okay.
Yeah, it's free for the citizens.
Oh, that's
If
awesome.
for me, if I'm not eligible to use public fund, I have to pay maybe just £600,
Okay.
and that's it. I can access to the healthcare
Oh,
freely.
wow. Okay.
Yeah.
Okay. So in we have the Affordable Care Act, but it's also known as Obamacare. So what president do you think created the Affordable Care Act?
Barack
Obama.
Obama?
Yes. Yes.
Yeah.
Trick question. So I'll read this. It was passed in 2010. The act aimed to provide affordable health insurance coverage to all Americans. The ACA, which is the Affordable Air Care Act, was also designed to protect consumers from insurance company tactics that might drive up patient costs or restrict their care. So the Affordable Care Act basically keeps these health insurance people from driving up prices, which is good.
yeah,
So more than 16 million Americans attained health insurance coverage within the first 5 years of the Care Act. But young adults still make up a large percentage of these newly insured people. But still, also, here's another thing: people with pre-existing health conditions can no longer be denied coverage. So if you have cancer and you didn't have health insurance and you wanted to sign up for the Affordable Care Act, you're allowed to. In the past, if you had cancer and you didn't have health insurance, you weren't allowed to sign up for health insurance because the health insurance companies knew they were gonna have to pay a lot of money. So I hate it. It's reprehensible. It's horrible. So also under the Affordable Care Act in America, prescription drug cost less money. So those vials of insulin that were $320, they don't cost $320 anymore. They probably cost like $100, if that. So yeah. So advantages of universal healthcare. By the way, do we all understand what universal healthcare is now?
Yes, I do.
Do
Everybody's covered. So who would like to read the first one?
I will.
Okay.
Lowers overall healthcare cost. The government controls the prices through negotiation and regulation.
Yeah. So at universal healthcare, the government does the heavy lifting for you. Next. Kamara.
Lower cost for hospital. Doctors only deal with one government agency. For example, US doctors spend 4 times as much as Canadians dealing with insurance companies.
Yeah. So because Canadians have universal healthcare, the doctors spend less money at the hospital. So basically, hospitals don't have to spend as much money. All right, next tier.
yes, create have their workforce. Studies show that preventive care reduces the need for expensive emergency room usage.
Yeah. So universal healthcare. If you didn't have health insurance, you're not going to go see a doctor. If you have health insurance, you're going to go see a doctor, even if it's for like a little minor thing, and that creates a healthier workforce. And next, V.
Early childhood care prevents future social costs. These include crime, welfare, independency, and health issues.
Yeah. So basically, do you guys understand what that's saying? Okay, so if you are a child and you have an issue, you are going to see the doctor right away. And the doctor, there's a greater chance that the doctor can help you out. So compared to children that aren't able to see a doctor and they might have like mental issues or something like that, like maybe they have like a brain issue or something. Later on in life, if those children don't see the doctor, there are social costs, which means they could get into crime, welfare dependency, which means the government would have to pay them to live, and health issues. They could commit suicide or something like that. Okay, and lastly, Kamara.
Higher education teach family how to make healthy lifestyle choice, which can prevent chronic disease.
Yeah, like obesity in America. Like if we had universal health care, we could probably get our weight down a little bit here. So, yeah. Okay, so here's some of the disadvantages. Guys, I'm trying to play both sides of this so you can make up your own mind and decide what you think is good. So, for universal healthcare, there are disadvantages. Number one, tier.
Yes. Healthy people pay for others' medical care. Chronic disease make up 90% of the healthcare cost. Is sick as 5% of the population create 50% of the total healthcare cost. while the health that's 50% only create 3% of the cost.
Yeah. So basically, they're saying that the sickest 5% create 50% of healthcare costs. So a small population of the people create a large population of the cost. Understand?
Mhm. Yeah.
Yeah.
But I will say for this that even with universal healthcare or even without universal healthcare, I think you're going to still have the same proportion because you're still going to have to pay for health insurance regardless. So you're going to be paying for even if you're not sick, you're still going to be paying for somebody else because the rates of health insurance will go up. All right, next, B.
People have less financial incentive to stay healthy without a
Copay.
copay. People might overuse emergency rooms and doctors.
Yeah. So that's another thing. They're saying that basically, like, you see this a lot with older people. If they have like a runny nose, like sniffles, they'll go to the doctor. They'll go to the
Yeah, mostly.
doctor. Yeah. So yeah. So they're saying that people will go just some people. They're saying that some people might just go to the doctor because they're lonely and they want somebody to talk to.
And
Seriously,
it's free. Yeah,
and
and it's
free.
free.
Yeah, 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 yeah. Exactly. So, all right. Who's next?
There can be long wait times for elective procedures. The government focused on providing basic and emergency health care.
Yeah. So one of the disadvantages of universal healthcare, people say that there could be a longer wait time to either see a doctor, to get to have your hand operated on, for maybe COVID treatment, maybe.
Mm.
I don't know. Yeah, who knows? But I don't know about that. But we don't have universal healthcare, so I can't say. All right, next.
And
Who's
Whose
that? Tier?
turn?
Tier, I think.
Me?
Yep.
Yeah. Government cost cutting can lead to reduce. Uh, sorry.
Availability.
I I think my video is not low, not clearly. Let me refresh my internet first.
Okay.
Okay. Now it's become better. The
Okay.
government cost cutting can lead to reduced availabilities of care. For example, doctors report the the Medicare payment cuts will force them to close many in-house blood testing labs.
Yeah. So they're saying that one of the disadvantages is that the government would cut the costs of healthcare, and it would close a lot of these facilities, which in turn might actually create um, the previous one, which might create longer wait times. Who knows? I don't know. We don't have that here, so I can't say. Next.
healthcare costs make up a significant portion of government budget. For example, some Canadian provinces spend almost 40% of their budgets on healthcare.
This could be true. I mean, that's 40% is a lot, but I'd rather have it go into healthcare than police force right now. So yeah, but who knows? All right, and last.
The government may limit those services with a low profitability of success. These includes drugs, forest condition, and expensive end-of-life care. In the United States, care for patients in the last 6 years of life makes up 25% of the Medicare budget.
Yeah. So Medicare, I'm pretty sure is for older folks. So for like grandmom and grandpop. So government may limit service with low probability of success. So if you have like a very bad cancer and you want to get treatment, the government might not treat you but this is just speculation. There aren't really cases of this so far. So, all right. I did that twice. All right, cool. So, by the way, guys, do you have any questions about any of this?
No.
No? No? Okay. Okay, what do you think? It's complicated,
It's
right?
great. I'm not really compared to yesterday,
Yeah.
but I quite like it because I can understand how the US system, the US health system work. You know, like I had to pay a lot of money if I live there.
Yeah, it's crazy, and if you have the smallest condition, which you're gonna have because maybe I should talk about food next. By the way, next week I'll talk about food in America. Um, you know, the food here isn't as good anymore. So it's a lot of sugar. So sugar is bad for you. So people end up getting health problems because of that sugar. So they have to go to the doctor more and pay more money. So
Yeah.
it's a whole thing. So yeah. So for homework, I want to know, what do you think of the health? If you think healthcare is a basic right for everyone, which I asked you before, and I want you to explain. And also, should America have universal healthcare, and why do you think that? Either you think they don't need it, we don't need universal healthcare, or we do need it. Also, if you want, I also let's see here. How do I get out of here? I also posted a bonus video right here on YouTube. It's about 11 minutes if you want to watch that. It's about what a lady is going through with healthcare right now. So if you want to watch that, cool. It would help maybe help you understand a little bit more about what healthcare is like in America for the average American. So, okay.
Yes.
All right, guys. Let me see here. Okay. Class is over. Sorry. 3 minutes. 3 minutes over. Don't get mad.
Bye.
All right.
I want.
Okay. All right. So I will see everyone tomorrow, and then we'll talk about the stock market. Cool.
Yeah.
Okay. Also, by the way, if you can think of anything you want to know about in America, that you're curious about for future lessons, please let me know, because I need ideas for lesson plans.
Okay.
Yeah.
All right.
Yeah.
All right.
I will.
I do
All right.
support.
All right. Awesome.
Bye.
I'll see everyone tomorrow. Okay.
Yeah, see you.
All
Yeah.
right. See ya.
Bye, teacher.
Bye.
Have a
Bye.
nice
Bye.
day.
You too. Bye bye.